Now, Dr. Pandori and I will take some questions from the media.
If you're on the phone line, if you could just keep your phone on mute, and we'll call you in a second. We're going to take a question from the room in Carson City first. Thank you.
Nice to see you, Governor. Wanted to ask about reopening and specifically in how it relates to the topic at hand today, the testing. Is there a level of testing that will inform that decision that you have already kind of benchmarked? And I'd like to follow up.
Okay, well, I don't have a benchmark date yet. I mean, I'm looking to the statistical analysis that's coming forward on a regular basis. I consult with experts like Dr. Pandori, like our medical advising team, to come up with various analysis. I'm looking at some of the data that's provided me. For example, the hospital intensive care admissions, the usage of beds, the beds that are left available, our rolling average of positive tests that we're taking, those sort of things to kind of determine when we've hit a plateau and we start to move down. So those are the things that I use.
And you haven't seen that, anything?
I haven't seen enough to give you a specific date.
Okay.
But we analyze this on a daily basis.
Okay, and then if you could you just kind of respond to some of the comments that we've seen from the mayor of Las Vegas and the Senate Majority Leader about urging kind of a more concrete timetable?
I'll answer the question, but I've got the preeminent person, one of the preeminent people in the country here to talk about testing, so I hope we can get to those questions. I heard some of the comments. I'm not going to respond to those comments or attacks that are made on me or my decisions. I can tell you that I spend 24 hours a day. My wife can tell you I don't sleep well anymore, analyzing these decisions. I know it's tough to stay home. I understand that, but it's tough for it to have Nevadans die on your watch. I fully understand that, and those are the instances I have to weigh, and I'm putting the lives of my fellow Nevadans ahead of any dollars, and we will open when the time is right. When the experts tell me and the data tells me that it's okay to open, then we're going to do it, and we're going to do it in a manner that's safe, and we'll get to where we need to get to. But for right now, I'm analyzing data. I'm relying on people that are an awful lot smarter than me, like Dr. Pandori, to give me the information that I need, and I will put the safety of our folks ahead of any profit. And people that think you can just say we're going to open back up and suddenly these hotels are going to be filled don't understand how the hotel industry works. So I've also had conversations with our business and community leaders as it relates to that. Thanks, Bill.
Okay, we'll go to James from the RGJ on the line. James, if you're on the phone, could you unmute your microphone and ask your question of the governor? Thanks.
Hi, Governor. I hope I didn't misunderstand you earlier when you were talking about a plan, or you made it sound like someone was working on a plan to potentially reopen the economy. Did I understand that correctly? Who's working on it, and can you give us the broad outlines of what you've established so far?
Well, Ava, as I've discussed, I don't know what specifically you're referring to, James, but I can tell you I'm looking at the data that is provided me by our medical experts, by our scientists. I'm also studying availability as it comes to our hospital surges and what might be available there if we do have a setback and we need to go up. I'm dealing with our mental health professionals as it relates to people that can provide me with information, and how the plan would be orchestrated. I've said all along would be in a very gradual manner, that restrictions would slowly be released or relieved a little bit. It's not going to be just flip on the light switch and everything goes back to normal, because that's not how we're doing things. We're going to start slowly. We're going to see how that goes after a period of time, and then add a little bit more, release a little bit more regulations, and go forward. But I do not know when that time is going to be, and it would be unfair to me for me to just guess out a date. I won't do that.
Thank you, James.
Sure.
We're going to go to a question in the room now. Thank you.
Governor, some of the rural counties, specifically White Pine County, have said they want to ask you that they would be exempt from any future shutdowns past the existing one you have in place. Are you going to allow counties to exempt themselves, or geographical regions?
Okay, as governor of the state of Nevada, I'm responsible for 17 counties. They have the responsibility of White Pine County. That's who they're elected to serve. I'm elected by all the citizens in the state of Nevada, and I will take the action that I feel is most appropriate for the state of Nevada. The idea of relieving one as opposed to another, and then it becomes a hot spot, just because they're smaller counties doesn't mean that they don't have an issue there. Humboldt County is one that we've had a significant number of positives. You've seen that in Elko. Haven't had my team analyze everything that's in White Pine County. We will look at every county as we move forward, but I don't know if there will be restrictions county by county.
When you describe a gradual reopening, are you referring to geographical regions or industries? What are you referring to?
I'm more referring to industries than I am to geographical areas, but we can look at geographical areas if there's areas of the state that have had no issues, but it will not be just everything back to normal even in those areas.
Thanks, Michelle. We're going to go back to the folks who are on the phone. Joe Bartels from KTNV. If you're on the line, could you please unmute yourself and ask your question?
Thank you, Governor, for taking my question. My question is about the external pressure that we've seen in other states. Michigan, for example, there's been protests of people that want to have their industries and government reopened, and we're hearing that there might be some protests as early as this weekend regarding the opening up of certain industries and the government. And we've also heard from Mayor Carolyn Goodman talking about she's been very critical of the closure order and has been kind of wanting things reopened. What do you say to those folks?
Okay, well, I'll go one more time to Mayor Goodman. I've told you, I don't know who she's relying on for her experts, because none of my experts have given me anywhere near that information. I rely on the experts that I have. I've got one of them here with you today. And I'm confident that they're providing with accurate information as it relates to the protests. I mean, we had one up here last week. I had one, and I'm a firm believer in our Constitution. Everybody's right to protest, and if they choose to protest, I just ask them to please exercise social distancing when they do their protests and keep us safe.
Thank you, Joe. We'll go to another question in the room here in Carson City now. Thank you.
Thank you, Governor. This question is for Dr. Pandori. These automated devices, these machines for high volume testing, will this open up the protocol for who and who does not get tested in Nevada?
Actually, when high throughput testing is available, more widely available in private and public health labs, it takes that question sort of out of the equation because it becomes possible to test both symptomatic and asymptomatic people. And put it another way, we wouldn't have to be as choosy if we had a high throughput, a high bandwidth for testing.
Thank you.
Yep.
Thank you. We'll go back to the phone lines. John Sadler from the Las Vegas Sun, if you're on the line, could you please unmute yourself and ask your question?
Hi, Governor. Thanks for talking with us. I just wanted to see the Democrats, both state and the DNC, have filed a lawsuit hoping for changes to the mail-in primary in June proposed by Secretary of State Zagafsky. Do you think that there should be any changes made to that process?
Well, you know, I have not read the lawsuit as of yet. I've seen some of the comments on social media as it relates to the lawsuit and some of the articles that will be written. I'm sure I'll be able to have my counsel give me a copy of the lawsuit to give me some late night reading tonight or early morning reading tomorrow to look at. I can tell you this, that I was born and raised in Milwaukee, and what happened in Milwaukee, Wisconsin was atrocious, that people were standing in long lines, you know, not social distancing. That's something that I certainly could not tolerate in Nevada. I believe that everyone has a right to vote. I know the Secretary of State put a lot of time in on this in consultation with the various registrars in the 17 counties, and we'll have to wait and see, but I have not weighed in on the lawsuit and haven't read it yet.
Thank you, John. We'll go back to questions in the room.
You said that the minorities were not being tested at the same rate as other states. Do you know if they're coming down with the greater rate of the disease when compared to other populations?
I can only give you anecdotal stories. It certainly has been the case across the country that they are coming, not that there's a propensity or they're more susceptible to the disease, just that the healthcare system and the socioeconomic system that they live under makes it more, I guess, likely that they could contract the disease or be infected. So it's something that we need to look at and see how it is impacting our minority communities. The same is true for our convalescent care facilities.
Thank you, and we'll go back to the phone line. Jacqueline Schultz, Fox 5, if you could unmute your microphone and ask the governor your question.
Thank you, Governor. Mayor Carolyn Goodman, as we mentioned, had sat down with numerous media outlets today. One of her reasons for why she believes the shutdown should end is because people right now have no way to put food on a table, and people will be hungry and homeless. What's your solution, and what's your words to the people of Nevada, how they can be protected economically while there is no work?
Okay, I cannot end the shutdown until I feel confident that we are in a good position as it relates to the spread of the virus, the hospitalization. Some people are more concerned with the business side of this and than the human toll that this virus is taking. The human toll is the most important to me. I am listening, and I will repeat this as many times as you'd like me to medical experts, to my scientific experts, and determining what is in the best interest of this community. I do not know who her experts are. You can see one of my experts here. You know who my experts are on my medical advisory team. It's all been made public, it's all posted. And I will stack up my medical experts against anybody else that's putting together a team that's gonna decide when we should open. I was elected to represent all the citizens, all the folks in the state of Nevada, and that's what I intend to do.
Thank you, Jacqueline. We'll go back to questions in the room here in Carson City.
Governor, yesterday a new call center came up and added potentially 100 new people to take calls. We've heard all along that that wasn't going to be resolving individual claims, and that seems to be the case. Do you have any evidence this is actually helping the situation?
Well, it's premature to say whether it is or it isn't. It's so early on that. I have read some of the media comments on that. I'm hopeful that it will. I mean, we've got a reduced number of password resets, which is clearly a positive for us. I think we're getting to people quicker. My staff, working with Dieter, continues to explore every option we have available to hook people up with their benefits, and we'll continue to do that. It's a big priority for me.
Do you have any solution for people that are forced to find a fax machine to get their documentation into Dieter?
Well, you probably don't know what a fax machine is. In my era, everybody had a fax machine. It's just the way it is. I mean, it's unfortunate. I don't have all the answers. I wish I did. And people, I understand people are frustrated. They're impatient there, and I don't mean that in a negative way, but they're frustrated and they want action. They want action now. I've got a team in the state here that is working so hard. Nobody has ever faced anything of this magnitude. And it's easy to sit back and criticize. And it's easy to throw stones. And it's easy to say that do this or do that. I will stand up for the group that I've got working for the state of Nevada, for the people that serve our state, as my staff, as our employees, as our team members, and I'll put them up against anybody. And if they want to continue to keep criticize me, don't criticize them.
Thank you, Michelle. We'll go back to questions on the phone line. Sasha from 8 News Now, if you're on the line, if you could unmute yourself and ask your question. Thank you.
And it wasn't you doing the criticizing, Michelle. I wasn't criticizing you, criticizing us in general.
Okay.
Sasha, you there?
I'm not hearing Sasha, so we're going to go to Siobhan McAndrew from the RGJ.
Thank you so much. How much more testing, Governor and Dr. Pandori, do you think we need? Exactly how much more testing? You said more is coming on. For both of you to be able to sleep at night, I know you're talking about the loss of lives and all of that. How much more testing should we have in Nevada? And how much has Dr. Pandori and other people in Nevada been able to procure some of the tests versus what we've gotten from the federal government?
Go ahead, Doctor.
I couldn't hear the second
How much more
one.
testing do you think we need? What can we do to procure more testing? I think that was kind of summed it up.
And how much more have we procured here ourselves in Nevada versus what we've received from the federal government?
How much have we procured from the federal government testing, and how much are you getting on your own?
Thank you. With regard to how much testing we need, I think the governor was addressing that earlier, and I agree 100%. We're not going to put an exact number, a magic number, on how many tests we need to determine whether or not the coast is clear, so to speak. We know we need more testing, and we're getting more testing. Now, with regard to how much we've been getting from the federal government versus how much we've developed here ourselves, I want to go back to the analogy that I made when I was talking about testing, comparing it to baked products, because it's actually a really good analogy. You need a pan, you need an oven, and you need eggs, and you need brownie mix. The federal government continues to provide a very adequate amount of brownie mix, which would be the material we use to detect chromosomes, what we call in the trade the primers and the probes. We're getting those from the CDC, and they're doing a fabulous job of providing them. Other things the federal government is not providing us would be extraction kits, and we've been able to obtain over 10,000 extraction kits from private sources. And now working with DEM and the National Guard, we're able to get those with great alacrity and ease. So it's been a balance. We've been getting a lot of things on our own here in Nevada to keep the engine of testing running, around 10,000 extraction kits. But the other part of the brownie mix or the testing, we still continue to get that from the federal government, and that's been really helpful that the CDC has been able to provide that. The collection kits, we've made well over, I would say, 4,000 of those, if not maybe over 5,000 of those now. And we're going to continue manufacturing those unless and until there's suddenly a lot more available, but we know that those aren't going to become available for quite some time.
If I could add just a little bit to that, there's two reasons for the testing. The first is you need the testing for people that are symptomatic so that we can determine if in fact they have COVID-19 or they don't. That is what we are using the testing for today. Now, some of the outlets do a great job, and you've got graphs on your sites and whatnot. And I know the Indy's got a great one up with their charts and whatnot. We use some tests for that, for the symptomatic individuals. I need to be able to test the percentage sample of our population that are asymptomatic to see if I could test 1% of our population and determine at random and determine what percentage of those people are infected, then we could extrapolate out in terms of our entire state what the propensity of the virus to have spread into our general population is. And that's where Dr. Pandori has been invaluable in terms of helping us to be able to expand that into more groups and get some of the healthier people that don't necessarily show symptoms.
We can take one more in the room.
Thanks. Going back to what possible directives might still be in play here, are you satisfied at this point with how people are adhering on the business closures, on other some of the directives that you've put forward? And specifically, I'm wondering if you're thinking about anything in terms of food service workers and whether they should be wearing masks or anything along those lines.
Well, there's a couple questions there. The vast majority of Nevadans, as from the chart, are doing a great job following the directives. I mean, they're staying home for Nevada, they're wearing a facial covering, they're not gathering in groups of 10 or more, they're social distancing, their activities are something that they think about before they do and they're in good interest. There are a few people that think that they are impenetrable, that they will not contract the virus and don't have a concern about spreading it to a family member or loved one. And I guess it doesn't matter how many restrictions I put into place, they're not going to listen to me. The vast majority are carrying the weight for everybody else. As it relates to masks for healthcare workers, or for restaurants, I would suggest that people wear a facial covering. I ask them not to wear an N95 when we're still short of N95s. I've got calls to send them into some of our nursing homes and some of our rural communities that, they need more masks and more gloves and more PPE. But I think a face covering is something that's good, beneficial.
Thank you. That's all we've got.
Good.
We're good.
Go ahead. Come
Governor,
on, Megan.
Next week will be 1 week out from the end of your shutdown directive. Are we going to know at this press conference a week from now whether that's going to be over yet or extended?
I don't know if we're going to be able to know exactly if it's over. We'll be able to give you more guidance in that direction. If I felt comfortable giving a guidance one way or the other today, I would give it to you. I am looking at data, and I mean on a daily basis. We have got some really smart people. I mean, I deal with all kinds of different issues, but I've got experts that deal just with this that I talk to, and they explain to me what happens if and I'll say, what happens if I allow this to open or that open, and they'll show me on a graph what could potentially happen. I cannot take the chance of overwhelming our healthcare system and not having a way back out of it. So it's going to have to be a gradual step. They will advise me if they think, based on the statistics that we have and the data that we've collected, if it's a time to start loosening the grip a little bit and opening up the faucet. And then we'll see how it works after a little while. If we don't have an enormous spike in positives or an emergency room usage or whatnot, they'll be able to give me that information as we move forward. It's not going to be just flip it on and the city's back open and the state's back open for business. It doesn't work like that. It's just not realistic. So I ask everybody to be patient with me. We will know a lot more next week in terms of how we're going to do in terms of extending or not extending various directives.
You think we'd have at least a week's notice before schools had to completely come back into session?
We will give as much notice as is humanly possible, and I think that that's a reasonable amount of time. Same as, I'm not going to say you can open up in 24 hours. People need to be able to make plans, and we will provide the information. As soon as I get it, I promise you, we'll pass it on. Okay, thanks a lot. Thanks for coming, everybody.